So I get asked all the time about medications to shrink fibroids, right? And Lupron is the number one or the biggest medication that is shown to cause shrinkage of fibroids. So there are pros and cons to everything. The pros of Lupron therapy is that it can definitely assist with bleeding, and it also can shrink fibroids. But for women that are looking to preserve their uterus, my question would be, what's the point? There is no point for Lupron therapy for shrinking fibroids because, number one, it makes fibroid surgery extremely difficult, meaning that when you treat a patient with Lupron, now the tissue planes of the fibroid become very distorted, the masses become soft, and it becomes ultimately a much more difficult surgery to now try to remove these masses that are now kind of embedded in the tissue, as opposed to the hard masses that normally are and can easily be shelled out. So any patient that comes to see me, I tell them absolutely, while you're on Lupron, we're not doing the surgery. You have to be off of that. It has to run its course. The other thing about it is like, what's the end goal, right? You can only be on Lupron up to a maximum of 18 months. So even if you do take Lupron for that period of time, what happens after it? So yes, it can cause some regression of fibroids, but for the long-term game or goal is the risk of, hot flashes and menopausal type symptoms worth the temporary shrinkage of fibroids. So my answer for fibroid therapy with Lupron, absolutely not. Lupron should be reserved as a end treatment option for patients with very, very significant endometriosis, stage 3, stage 4, that are refracted to therapies that are lesser, like hormone suppressants that are just not working well. And then Lupron can be given as an adjunct to treat stage 4 or stage 3 or 4 endometriosis, but never for just fibroids. Now, if a woman was getting a hysterectomy and needed some regression in the size of the uterus for laparoscopic or to aid in assisted laparoscopic or robotic surgery, that is a consideration for sure. But to that point, it also is the risk versus benefit of the woman actually now having to have potential side effects of that versus the skill of the doctor being able to do the laparoscopic or robotic surgery versus being able to just do the robotic surgery without being on this medication that can cause, great side effects. But not just therapy for fibroids just for the sake of shrinking fibroids. The risks do not outweigh the benefit.